Alright, PP, scene safe. What's my nature of illness?
You are dispatched to a 20-year-old male with difficulty breathing.
Alright. How many patients do I have?
You have one.
Alright, I'm gonna call for backup. So I need ALS, PD, fire, and then I'll consider C-spine immobilization. What's my general impression of my patient?
Your patient has labored breathing and he's in tripod position.
Alright. Is he alert? What's his level of consciousness?
He's alert, he tracks you.
Alright. Does he have any major bleedings?
No major bleedings.
Alright, the chief complaint is difficulty breathing. Alright. Sir, can you hear me, sir?
Yeah.
Alright, so his airway's clear. What's his rate rhythm quality of his breathing?
He's breathing at 9 times a minute labored.
9 times a minute labored. Alright, I'm gonna put him on a non-rebreather at 10 to 15 liters. And I'm gonna check for his lung sounds.
Okay.
So I'm gonna hear it mid-axillary and mid-clavicle, or mid-clavicular.
Okay, you hear bilateral mid-clavicular wheezing.
Wheezing, alright. So I'm gonna check his circulation. What's his pulse?
He has a pulse of 120.
What's his skin temperature, color, and condition?
It's getting a little gray, and a little bit cool to the touch.
And he has no major bleedings?
No major bleeding.
Alright, I'm gonna initiate rapid transport. I'm gonna go through my OPQRST. So how did this problem come about? Was it sudden? Did it take a long time? How did it? Sudden, okay. Does anything make it better or worse?
Everything. It's
Everything?
just bad.
Alright. How would you describe this pain?
It's not a pain, I just can't breathe well.
You just can't breathe well? Alright. Does it radiate anywhere? Like, just not pain, right?
No.
Okay. How would you rate, like, how you're feeling? 1 to 10, 10 being the worst.
2.
2? Alright. And how long ago did this happen?
2 hours ago.
2 hours ago?
Started not being able to breathe as well.
Alright, so I'm gonna go through the sample history. So, you said you're not feeling like you're having trouble breathing about 2 hours ago.
Yeah.
Are you allergic to anything?
No.
Do you have any medications?
Yeah. Albuterol.
Albuterol? Okay. Do you have any past medical history?
Asthma.
Asthma? Okay. What's the last time you ate?
This morning.
This morning? Okay. What time is it now?
It is 4:32.
Okay. And then what were you doing before the pain started?
Just at home.
Just
Watching TV.
Alright. I'm gonna get his vitals. I'm gonna get his pulse, rate rhythm, quality of his breathing, his level of consciousness, blood glucose, BP. Did I say BP already? SpO2.
Okay, his pulse is staying at 120. He has a blood pressure of 130 over 80. He's breathing at 9 times a minute, labored, but he still tracks you. He's still alert.
Right.
His blood glucose is low at 80, and his SpO2 is at 89%.
89% with the non-rebreather.
Yes, currently.
Alright, so I think this patient has experienced an asthma attack, so I'm gonna give him 2.5 milligrams of albuterol.
Thank you.
And if the condition gets worse, I'll have to bag him. So I'm gonna re-go through my primary assessment. So his air is still clear. What's his rate rhythm and quality of his breathing after the albuterol?
His He's breathing 16 times a minute. Less labored. What else do you want?
Can I get his circulation, his pulse?
His pulse is 108.
Can I get his skin temperature and color?
His skin is becoming pinker.
Pinker. Secondary assessment, does the pain feel better? Can you feel like you're breathing better?
Yeah.
Alright. I'll reassess his vitals. I already got his rate rhythm and quality, so I guess I'll take his BP.
It is 110 over 80.
I still think I'm gonna initiate rapid transport, and I think this patient's pretty stable. I'll check up on him every 5 minutes for reassessment.
Anything else you want to check?
I'll check his lung sounds. What do I hear in the mid-clavicular and mid-axillary?
You hear less wheezing.
Less wheezing, okay. I think he's good.
Anything else? Any vital?
Stop the tape. Stop the tape.